Hi everyone, I'm Matt Sorensen here for another self-assessment / treatment technique. Today I'm going to show you how to assess and potentially treat the diaphragmatic recess. Now the diaphragmatic recess is the potential space between the pleura and the diaphragm. A simple way to assess this is to simply grab the top of your diaphragm, which will be sitting at around the 5th, 6th rib. Take a deep breath in and then breathe out. Whatever side you feel restricted on more, that's the side that we're going to treat. Now, all you need to really do is to have the palm and pads of your fingers and hands around anywhere between the 6th to 10th rib. So I'll just show you here to give you some orientation. That's my xiphoid process right there, and this is my nipple line here. So to give you some idea of what location that is on the body. Now what we're going to do, I'll use two hands for some leverage. I can do this lying down or seated. It doesn't really matter as long as you can get the effect of it. All I'm going to do now is push slightly down to my right hip, and as I'm pushing down to my right hip, I'm also going to turn my head to the left, and I'm just going to follow what wants to happen underneath my hand. And my hand wants to go back towards the wall here. My head wants to do that more and more. And I want to really push out on the out breath. As I push out, I can feel it releasing. And then I get a softening underneath my hands, and that's it. This can come in really handy for anyone with diaphragmatic tension, breathing problems, very important this time in our history, and should give you a lot of relief. Just to reiterate on how to find the landmark, you want pretty much as you can do that. Whatever flexibility your shoulders will allow to do this, that's the area that we're targeting. The pleura of the lung comes down to about here, and the diaphragm, when we exhale, comes back up to here. So when we breathe in, we create a recess, which is that space. Now, when you're breathing in with your lungs, you'll notice the bottom of your ribs expand a little bit more than the top of your ribs. So that's what we're going for, that top end range of expansion. So one more time, breathing in, and then as I breathe out, I'm going to draw my hands away from my head and turn my head the opposite direction. And there we have it.